Welcome to our comprehensive guide on NCLEX high-yield laboratory values and arterial blood gases, or ABGs. If you're preparing for the NCLEX exam as a registered nurse, understanding these values is absolutely crucial. In this video, we'll break down the most commonly tested lab values, explain why they matter, and give you tips to remember them. We'll also cover ABGs, which often appear in exam questions. Let's start by understanding why lab values are so important for safe nursing practice and patient care. Lab values are more than just numbers, they're critical indicators of a patient's health status. As a nurse, you'll use these values to assess, monitor, and intervene appropriately. On the NCLEX, you'll be expected to recognize abnormal values and know what actions to take. For example, a low potassium level could signal a risk for cardiac arrhythmias, while abnormal sodium levels might indicate fluid imbalances. Understanding these values helps you prioritize care and ensure patient safety. Basic Metabolic Panel, or BMP, is a group of tests that measures key electrolytes and metabolic substances. It includes sodium, potassium, chloride, bicarbonate, blood urea, nitrogen, BUN, creatinine, glucose, and calcium. Each of these values provides important information about a patient's metabolic and renal function. For the NCLEX, you should be familiar with the normal ranges and what deviations might mean for your patient. Start with sodium. The normal range for sodium is typically 135 to 145 mg/L. Sodium is essential for maintaining fluid balance, nerve function, and muscle contractions. Hyponatremia or low sodium can cause confusion, seizures, and even coma. Hypernatremia or high sodium may lead to dehydration and neurological symptoms. On the NCLEX, you'll need to recognize symptoms and interventions for both conditions. Potassium is another critical electrolyte, with a normal range of 3.5 to 5 mg/L. It plays a vital role in cardiac and muscle function. Hypokalemia or low potassium can cause muscle weakness, cramps, and dangerous heart arrhythmias. Hyperkalemia or high potassium may also result in cardiac issues, including potentially fatal arrhythmias. Knowing how to respond to abnormal potassium levels is a must for the NCLEX. Chloride's normal range is 98 to 106 mg/L. It works closely with sodium to maintain fluid balance and acid-base status. Abnormal chloride levels can indicate dehydration, kidney problems, or acid-base disturbances. On the NCLEX, you may see questions about chloride in the context of metabolic or respiratory conditions, so it's important to understand its role in the body. Bicarbonate, or HCO3, has a normal range of 22 to 26 mg/L. It's a key component of the body's buffer system, helping to maintain acid-base balance. Low bicarbonate can indicate metabolic acidosis, while high levels may suggest metabolic alkalosis. Understanding how bicarbonate interacts with other ABG values is essential for interpreting acid-base disorders on the NCLEX. Blood urea nitrogen, or BUN, typically ranges from 7 to 20 mg/dl. BUN is a marker of kidney function and protein metabolism. Elevated BUN can indicate renal impairment, dehydration, or increased protein breakdown. Low BUN is less common but may be seen in liver disease or malnutrition. For the NCLEX, know what causes BUN to rise or fall and what interventions are appropriate. Creatinine is another important indicator of kidney function, with a normal range of 0.6 to 1.3 mg/dl. Elevated creatinine usually points to impaired renal function. It's more specific than BUN for kidney health. On the NCLEX, you'll often see creatinine levels in questions about acute or chronic kidney injury, so be sure to remember the normal values and what they mean. Glucose levels are vital for assessing metabolic health. The normal fasting glucose range is 70 to 99 mg/dl. High glucose may indicate diabetes or stress, while low glucose can cause confusion, seizures, or even coma. On the NCLEX, you'll need to recognize symptoms of hypo and hyperglycemia and know how to intervene quickly to prevent complications. Calcium's normal range is 8.5 to 10.5 mg/dl. It's essential for bone health, muscle contraction, and nerve transmission. Hypocalcemia can cause tetany, muscle spasms, and cardiac issues, while hypercalcemia may lead to weakness, kidney stones, and arrhythmias. For the NCLEX, know the signs and symptoms of abnormal calcium levels and the appropriate nursing intervention. Magnesium is another important electrolyte, with a normal range of 1.5 to 2.5 mg/L. It's involved in muscle and nerve function as well as cardiac rhythm. Hypomagnesemia can cause neuromuscular irritability and arrhythmias, while hypermagnesemia may result in muscle weakness and respiratory depression. Recognizing these symptoms is key for NCLEX success. Phosphate's normal range is 2.5 to 4.5 mg/dl. It's important for bone health, energy production, and acid-base balance. Hypophosphatemia can cause muscle weakness and respiratory failure, while hyperphosphatemia may be seen in kidney disease. For the NCLEX, be prepared to identify causes and symptoms of abnormal phosphate levels. Complete blood count, or CBC, is another high-yield lab panel for the NCLEX. It includes red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. Each component provides insight into oxygen-carrying capacity, immune status, and clotting ability. Understanding the normal ranges and clinical implications of CBC results is essential for safe nursing practice. Red blood cells carry oxygen throughout the body. The normal range for RBCs is 4.5 to 5.9 million cells/ml for men, and 4.1 to 5.1 million cells/ml for women. Low RBCs can indicate anemia, while high RBCs may be seen in dehydration or polycythemia. Recognizing the significance of abnormal RBC counts is important for NCLEX questions related to oxygenation and anemia. White blood cells are essential for fighting infection. The normal range is 4,500 to 11,000 cells/ml. Elevated WBCs may indicate infection, inflammation, or leukemia, while low WBCs can signal bone marrow suppression or immunodeficiency. On the NCLEX, you'll need to interpret WBC counts in the context of infection control and immune response. Hemoglobin carries oxygen in the blood. Normal values are 13.5 to 17.5 gdl for men and 12 to 15.5 gdl for women. Low hemoglobin indicates anemia, while high levels may be seen in dehydration or chronic lung disease. For the NCLEX, know the symptoms of anemia and the importance of monitoring hemoglobin in patients with bleeding or chronic illness. Hematocrit measures the percentage of red blood cells in the blood. Normal ranges are 41–53% for men and 36–46% for women. Low hematocrit can indicate anemia or blood loss, while high levels may be seen in dehydration. On the NCLEX, you'll need to interpret hematocrit in the context of fluid status and oxygenation. Platelets are crucial for blood clotting. The normal range is 150,000 to 400,000 platelets/ml. Low platelets or thrombocytopenia can increase bleeding risk, while high platelets may be seen in inflammation or certain cancers. For the NCLEX, recognize the signs of bleeding and the importance of monitoring platelet counts in at-risk patients. Coagulation studies assess the blood's ability to clot. The most common tests are PT, INR, and APTT. These values are especially important for patients on anticoagulant therapy. For the NCLEX, you'll need to know the normal ranges and what to do if values are too high or too low, as this can affect bleeding and clotting risks. Prothrombin time, or PT, measures how long it takes blood to clot. The normal range is 11 to 13.5 seconds. Prolonged PT can indicate liver disease, vitamin K deficiency, or anticoagulant use. For the NCLEX, know when to report abnormal PT values and how to manage patients at risk for bleeding. International Normalized Ratio, or INR, standardizes PT results. The normal range for most patients is 0.8 to 1.1, but for those on warfarin, the therapeutic range is typically 2 to 3. High INR increases bleeding risk, while low INR may mean inadequate anticoagulation. For the NCLEX, know how to adjust therapy based on INR results. Activated partial thromboplastin time, or APTT, measures the effectiveness of the intrinsic clotting pathway. The normal range is 25 to 35 seconds. For patients on heparin, the therapeutic range is typically 1.5 to 2.5 times the normal value. Prolonged APTT increases bleeding risk, so it's important to monitor closely in patients receiving anticoagulation therapy. Arterial blood gases, or ABGs, are a set of tests that measure oxygenation, ventilation, and acid-base status. The key components are pH, PaCO2, PaO2, HCO3, and SaO2. ABGs are essential for assessing respiratory and metabolic function. For the NCLEX, you'll need to interpret ABG results and identify common acid-base disorders. Normal pH range for arterial blood is 7.35 to 7.45. A pH below 7.35 indicates acidosis, while a pH above 7.45 indicates alkalosis. Maintaining a normal pH is vital for cellular function. On the NCLEX, you'll need to interpret pH in the context of other ABG values to determine the underlying disorder. PaCO2, or partial pressure of carbon dioxide, has a normal range of 35 to 45 mmHg. It reflects the respiratory component of acid-base balance. High PaCO2 indicates respiratory acidosis, while low PaCO2 suggests respiratory alkalosis. For the NCLEX, know how to interpret PaCO2 in the context of respiratory disorders. PaO2, or partial pressure of oxygen, normally ranges from 80 to 100 mmHg. It measures the effectiveness of oxygenation in the blood. Low PaO2 indicates hypoxemia, which can be life-threatening if not addressed. On the NCLEX, you'll need to recognize signs of hypoxemia and know how to respond appropriately. Carbonate, or HCO3, in the context of ABGs has a normal range of 22 to 26 mx/L. It reflects the metabolic component of acid-base balance. Low HCO3 indicates metabolic acidosis, while high HCO3 suggests metabolic alkalosis. For the NCLEX, you'll need to interpret HCO3 alongside pH and PaCO2 to determine the type of acid-base disorder. SaO2, or oxygen saturation, normally ranges from 95% to 100%. It measures the percentage of hemoglobin saturated with oxygen. Low SaO2 indicates hypoxemia and requires immediate intervention. On the NCLEX, you'll need to recognize critical values and know how to respond to low oxygen saturation. Respiratory acidosis occurs when there's too much carbon dioxide in the blood, usually due to hypoventilation. ABG findings include low pH and high PaCO2. Causes include COPD, respiratory depression, or airway obstruction. For the NCLEX, know the symptoms such as confusion and drowsiness and the appropriate interventions like improving ventilation. Respiratory alkalosis results from excessive loss of carbon dioxide, often due to hyperventilation. ABG findings show high pH and low PaCO2. Common causes include anxiety, pain, or fever. On the NCLEX, you'll need to recognize symptoms like lightheadedness and tingling, and know interventions such as encouraging slow, deep breathing. Metabolic acidosis occurs when there's an accumulation of acid or loss of bicarbonate. ABG findings include low pH and low HCO3. Causes include diabetic ketoacidosis, renal failure, or severe diarrhea. For the NCLEX, recognize symptoms like rapid breathing and confusion, and no interventions such as treating the underlying cause and administering bicarbonate if needed. Metabolic alkalosis is characterized by high pH and high HCO3. It's often caused by vomiting, diuretic use, or excessive antacid intake. Symptoms include muscle twitching, irritability, and arrhythmias. For the NCLEX, know how to identify metabolic alkalosis and the appropriate interventions, such as correcting fluid and electrolyte imbalances. Compensation refers to the body's attempt to restore normal pH by adjusting respiratory or metabolic components. For example, in metabolic acidosis, the lungs may increase breathing to blow off CO2. On the NCLEX, you'll need to determine if compensation is present by analyzing all ABG values together. Helpful mnemonic for ABG interpretation is ROME, respiratory opposite metabolic equal. If pH and PaCO2 move in opposite directions, it's a respiratory disorder. If pH and HCO3 move in the same direction, it's metabolic. Using mnemonics can make it easier to quickly identify acid-base imbalances on the NCLEX. Lab values are considered critical and require immediate action. For example, potassium below 2.5 or above 6.5 mg/L, sodium below 120 or above 160 mg/L, or glucose below 40 or above 400 mg/dl. On the NCLEX, you'll need to recognize these values and know the appropriate emergency interventions to protect patient safety. Trends in lab values are often more important than a single result. For example, a steadily rising creatinine may indicate worsening kidney function, even if values are still within normal limits. On the NCLEX, pay attention to trends and changes over time, as these can signal early deterioration or improvement. Lab panels often include multiple related tests. For example, a renal panel includes BUN, creatinine, and electrolytes. Understanding how these values interact helps you make better clinical decisions. On the NCLEX, you may be asked to interpret a panel rather than a single value, so practice looking at the big picture. It's important to know common causes of abnormal lab values. For example, infection can raise WBCs, dehydration can increase sodium and hematocrit, and kidney failure can elevate BUN and creatinine. On the NCLEX, you'll need to connect abnormal labs to possible underlying conditions and prioritize care accordingly. Many medications can affect lab values. For example, diuretics can lower potassium, anticoagulants affect PT-INR, and steroids can raise glucose. On the NCLEX, you'll need to recognize medication effects on labs and adjust care plans as needed. Always consider recent medication changes when interpreting abnormal results. Patient safety is always the top priority. Abnormal lab values can signal life-threatening conditions, so prompt recognition and intervention are essential. For the NCLEX, always think about how lab results impact patient safety and what actions you should take to prevent harm. Memorizing lab values can be challenging, but using mnemonics, flashcards, and practice questions can help. Group similar values together and focus on the most commonly tested ones. For the NCLEX, prioritize high-yield values and understand the clinical significance behind each number. Practicing NCLEX-style questions is one of the best ways to reinforce your knowledge of lab values. Read each question carefully, look for clues in the scenario, and use process of elimination. The more you practice, the more confident you'll become in recognizing and interpreting lab values on the exam. Let's quickly review the most important lab values for the NCLEX. Sodium 135/145, potassium 3.550, calcium 8.510, magnesium 1.525, BUN 720, creatinine 0.613, glucose 1799, WBC 4500-11000, hemoglobin 1217.5, platelets 150K 400K, PT 1113.5, INR 0.811, APTT 2535. pH 7.35745, PaCO2 3545, HCO3 2226, and SaO2 95 100%. Congratulations on making it through this high-yield review of NCLEX laboratory values and ABGs. Remember, understanding these values is not just about passing the exam, it's about providing safe and effective care for your future patients. Keep practicing, stay confident, and trust in your preparation. You've got this.